Hi there. Can I ask you a couple questions?
Sure, I guess.
My name's David. I'm with Northwest College. I'm a student nurse, and I have a urinary tract project.
Ah, that must be why you're in scrubs.
Yeah. So this is just to see about common knowledge of the public. Where does the kidney get the fluid to make urine? Blood, intestines, or the liver?
Well, I would think... See, I don't know anything medically, but I would guess liver. Am I right?
No, it's actually the blood.
Is it the blood?
Yeah. Where does the kidney get the fluid to make urine?
Okay, intestines.
No!
This is hard.
Blood, intestines, or the liver?
I will say the liver.
No.
Oh.
The kidneys filter the blood.
Oh, that's right.
Blood, intestines, or liver?
Intestines. Or liver.
Nope. Blood.
Blood? Really? You're kidding.
No.
Do you know how many kidney transplants are performed in 1 year? 17,000.
Hi, Miss Anita.
Hi, David. How you doing?
Good. I'm working on my urinary tract presentation.
Well, I'm glad you are, because I was just studying that. Question here that I think you should know about. Try this one. Describe the formation of urine. Include the concepts of glomerular filtration, tubular reabsorption, and tubular secretion. So that should give you a good base of what you might need to study on.
Ryan, Miss Anita wants you to describe the entire urinary system.
Okay. Well, Dave, urine formation is more complex than the kidney simply acting as a screen to toxins and wastes in the blood. Here, take a look at the book here. The process does start with filtration in the Bowman's capsule. Basically, blood is pushed by blood pressure through capillary membrane and small openings in the podocytes. This is filtration of our blood and results in 125 ml of filtrate a minute, roughly 4 ounces per minute, or about a Coke can, 12 ounces every 3 minutes. But we don't urinate this much, so this is where reabsorption comes in, and reabsorption is responsible for recovering 99% of what was initially filtered. Chemically, what this means is our body uses energy to push sodium and sugar, followed by water, back into the bloodstream, so we don't lose this good stuff that we need. Lastly, secretion is in a sense a fine-tuning of the filtration process. Secretion moves toxins from the blood vessels back into the tubules to be eliminated. Indeed, secretion and filtration can move something especially harmful, like drugs, much faster than filtering alone. So in this way, the two can work in unison. Hi there, do you have any questions about the urinary system?
Let's see if I can do. Yeah, how much urine do we make a day?
That's a good question. I think it's about anywhere from a liter to a liter and a half per day of urine.
That's a lot.
Yeah.
How much urine can the bladder hold? 10 liters, 3 liters, 1 liter, or a half a liter?
Well, I'm gonna guess a lot, because sometimes I just piss forever. You know, so I'd say it'll hold, I'd say it holds 3 liters.
1 liter.
1 liter, that's it?
Yep.
Well, then why does it take so long to come out?
Yeah, because you stretch it too much.
Oh, okay, maybe that's it. Maybe I should keep my hands off of it.
Yeah. Oh, yeah.
Yeah.
No, stretch the bladder.
Oh, I got you, I got you.
10 liters, 3 liters, 1 liter, or a half a liter?
A bladder. I'm gonna say 1 liter.
Ding, ding, ding.
Oh, hey.
10 liters, 3 liters, 1 liter, or a half liter?
I'd say 3 liters.
1 liter.
1 liter?
That's about all you can stretch it until you start damaging it.
Oh, okay.
What if somebody's like sick? How much you can do?
Somebody's sick, it probably is gonna be less unless they're drinking a lot of fluid, in which case, I mean, it depends on how it comes out. You know, maybe they're vomiting a lot or losing fluid somehow else. But I guess it all depends on how much intake and output you have.
So this is where it all begins. What we eat and drink go through our GI system and get absorbed into our blood. All the nutrition, all the liquids, everything that doesn't get passed gets absorbed into the blood. Alright, so where do we get urine? We get it from the kidneys. Ryan already spoke about the filtration process and reabsorption, but what really is happening? Now we have the 2 kidneys. Those have all the filters. The filters are called the nephrons. Well, each kidney has 1 million nephrons. They're the ones that actually do the filtering. And they go down, the urine, the waste product, is collected, and comes out the ureter. So after the urine is formed, it comes down the ureters, enters into the bladders at the ureter openings, 2 holes, one-way valves. You get enough urine, gives you the sensation to pee. It releases the involuntary sphincter, a muscle, and then when you're ready to pee, you go pee. You open the voluntary sphincter. Urine goes out through the urethra. Now you're wondering, why is it so difficult to pass a kidney stone? Kidney stone is collected calcium, and these ureters are about 1/4 of an inch wide, but they're not hollow like a drinking straw. What we notice, here's a cross section of one cut in half, and you'll see that anything a fraction of the size bigger than these openings would just be pain. How much fluid do the kidneys produce each day? 180 liters, 3 liters, 18 liters, or 1.5 liters, 1,500 milliliters?
18 liters.
A little bit low, 10 times as much.
Oh, really? I wouldn't have guessed that.
180 liters, roughly 45 gallons.
I will pick B, 3 liters.
Actually, 180 liters, nearly 45 gallons.
Wow.
It produces, but guess what? We reabsorb, can you believe it? 99% of that fluid.
Oh my goodness.
Yeah, and actually the reabsorption helps maintain our blood pressure.
Oh,
Yep.
very cool. That's why it's important to drink water.
I'm gonna have to really guess on this one. I'm gonna say 18.
180 liters.
Oh, holy crap.
That's like 45 gallons.
Nice.
I think 1,500 milliliters.
1.5 liters. 180 liters.
What?
And if you're dehydrated,
If you're dehydrated, a lot less probably.
like
Like-
half a liter?
It might be half a liter. It could even be less. I mean, depending on how much water your kidneys are retaining. You know, via all the processes, all the chemical processes, and and things that your brain is telling your filtration system, you know, hey, stop peeing, you know, if it needs the water. So.
The life expectancy of a patient on dialysis with CRD is about 3 to 5 years.
Okay, true or false? Doctors used to taste the patient's urine.
That sounds weird enough to be true.
You're right.
Yeah.
First thing in the morning. Doctors used to taste the patient's urine. True or false?
I would have to say false. I would hope it was false.
It's actually true. Doctors used to taste the patient's urine. True or false?
True.
You know that already.
Yes, they didn't have the instruments back in the days that they do now.
Awesome. Doctors used to taste the patient's urine. True or false?
I believe that. True.
It's true.
What if your kidneys something's wrong with your kidneys? How would you know it could you find out through your urine, or?
You know, I think you could. You'd have to run tests probably, and the urine can tell you a lot of information about what's going on in your body. Not quite as much as blood, but yes, the urine. If you take a urine sample, you can test it, and they can find out if there's sugar in your urine or toxins or anything else, protein, you know, things like that shouldn't be coming out.
I think we're doing good so far.
Where does urine get the pigment for the yellow color? Bile, vitamins, or lemonade?
I would say it's bile.
You're right.
Yeah, well, it's about time I got one right, because, you know, if I didn't get one right pretty soon, I don't want to play anymore.
So you're saying we have bile in our blood?
I guess, yeah, because I don't think it's vitamins, and I know it's not lemonade, so it's just a process of elimination. It's got to be bile.
Yeah.
Right? Okay.
Bile is extracted from our intestines.
Yeah, but that sounds weird.
Yeah.
It doesn't quite compute for me, but yeah, I'm sticking with bile.
Next time you talk to Grandma, you can tell you have bile in your blood.
Yeah. Okay, I'll do that. That'll be like the first thing I say.
Yeah.
Hi, Grandma. You know you got bile in your blood.
Well, bile,
Okay.
vitamins, lemonade.
Vitamins.
Nope.
Okay.
It's actually
Bile.
bile.
I'm not gonna say lemonade, even though it's a refreshing drink. But,
Not
I'm
urine.
gonna say vitamins.
No, it's bile. Where does urine get the pigment for the yellow color?
Bile.
Not lemonade?
No. Bile.
Yeah. At this point, you're probably thinking that the urinary system is all fun and games. But there is a serious side. Through the reabsorption process, the urinary system regulates our electrolyte levels, our fluid levels in the body, and our blood pressure. And how many milligrams equal 1 gram? 1/100th, 2.2, 650, 100, or 1,000?
100.
1,000!
1,000. I was getting ready to guess 1,000 because
You would have been right.
Yeah, but you know.
How many milligrams equal 1 gram?
1,000.
Correct, yay!
Or that's D actually, yeah.
D, yeah.
Oh good. Yay, I got one right.
This was on that Jeopardy question. No, I'm kidding.
Well, in that case, no, I can't give you the answer.
No. I'm gonna say 650.
Good guess. It's actually 1,000.
1,000.
Right. Ding, ding, ding.
Hey, I'm a math person, science person. Come on.
got a lot of answers today, but there's one question that still needs to be asked. Should I go pee now, or should I wait till later? And the answer is, go pee now. We learned that the bladder can hold roughly 1,000 milliliters, that's 1 liter. But do we want to stretch it out like that all the time? No. There's a muscle layer that goes around the bladder that helps you push the urine out when you need to go. And it's called the transitional epithelium. It's a layer of stretchable muscle that allows the bladder to increase in size and then also go back to regular size. If you stretch it out too much, you can damage your bladder permanently. So it's always best, when you need to go pee, go pee.
You know, you have a lot of good questions. Have you ever thought about nursing?
Actually, yeah, I have. Well, today, you know.
Because I recommend you enroll at Northwest College in Riverside, California. Had to throw one out there, you know, shameless pitch to the public here.
The more I find out about this medical stuff, the more grossed out I'm getting.
Close up. All right.
I don't think so.
I don't think so.
So you asked if, and you said that you think that no, I don't think it would have an effect on that, because your temperament, I mean, that's totally separate from anything. Dave, do you want to help me here?
Glad you asked. Well, nice giggle there. Hi, Miss Anita.
The hardest to be serious. Okay, take two.